Earlier in our talk, you mentioned vaccines and autism, and that's such a hot button issue. A lot of people think that it's either yes, they cause, or no, they don't. But a lot of people that we've talked to said it's a more gray area, that there's also some things that come into play in addition to vaccines that can trigger it. What have you seen? What do you think?
Well, I'm not a big fan of vaccines, but if you look at the theory of vaccines, I mean, the purpose of a vaccine is to give a person a small dose of the disease, let's use measles, so that it stimulates, go back to the immune system, it stimulates a Th1 response to help, that's trying to kill the measles, and you have to have enough of a dose that that person's body can't kill it, so it'll stimulate a Th2 response. That's the B cell response that will make antibodies. So that's why a person that's vaccinated isn't necessarily immunized. So an immunization is that that person has circulating antibodies against the thing that you vaccinated against. So if I can measure the measles antibodies in my blood a month after I got vaccinated, then it worked, right? The problem is, how do I know what dosage to give this person that's going to stimulate a Th1 and a Th2 response so I make antibodies against that thing? Well, you can't even dose them based upon weight. It's totally based upon that person's immune response, which is going to be individual. So they're just guessing. So in theory, if vaccines actually stimulated a Th2 response and made that person made antibodies against that thing in every case, then vaccines are a miracle, right? The problem is that in order to stimulate that Th2 response in a person, you have to give enough of the measles that it's going to give the person measles, usually. So then they have to add these things, these chemicals into the vaccines called adjuvants. That will be other things to stimulate an immune response, so that hopefully the B cell response will make antibodies against the measles and not against the other things, because the other things are inert that you can't make antibodies against. So in theory, vaccination is phenomenal. In real life, it doesn't work quite so well, especially when you're dealing with a 6-pound baby that has no blood-brain barrier yet, and you're pumping them with the adjuvants that, if they have defects on the detoxification pathways that are supposed to get rid of those adjuvants, they're going to circulate in the blood, because the liver is going to be a slow detoxer because of those defects, and they're going to settle somewhere. And if it settles in the brain, it could cause all sorts of problems. Not just, we want to go, oh, vaccines cause autism. Well, vaccines can cause, you can't argue with that. It's just physiology. But they don't cause autism in everybody. So if you have really healthy detox pathways, that baby does, they could just flush those adjuvants out and have no problems. It's when they don't have healthy detox pathways, either because of genetic defects or because this baby the mother was on medications, and so that baby's liver is already taxed, or because they're recommending Tylenol after a vaccine, which shuts down a whole bunch of the methylation pathways. That's a whole other conversation. Then they're going to be much slower detoxers. So there's other factors that are involved that should be addressed. But most general practitioners giving out vaccines don't understand anything I just said about the genetics. But if you're not educated in that manner, it's kind of foolishness. So I recommend, if you want to vaccinate your child, that's great. You should know what their genetic pathways are like beforehand. They got PON1 pathways, they have MTHFR pathway defects, they have cytochrome P50 pathway defects, and you're going to vaccinate? Well, good luck with that. That's, to me, child abuse. And that's just, and the sad thing is people are ignorant to that, but there isn't a reason. The knowledge is out there. Maybe there's just not a lot of people that know what I'm saying is true, but you can do your own research and understand that where these adjuvants detox on and the pathways that they detox on, and look at that yourself. But to know that is important, and to not know that can be a grave decision that you make.